Hello, my name is Dr. Rachel Winter. I studied medicine here at Leicester and I now work as a psychiatrist and as a clinical lecturer. I teach on the medicine module on the Medicine with Foundation Year programme, and I also spend some of my time in research, and my particular interest is in clinical empathy and how we use the evidence that we have to best teach medical students to be empathic practitioners and to provide the best empathic care. So this talk is about becoming an empathic doctor and why we think at Leicester this is so important. I hope that through this presentation you too will have a better understanding of what clinical empathy is and why we need to train future doctors to be better at practicing medicine with empathy. To start us off, I thought we could think about what empathy means. When I ask students that I work with what they think empathy or being empathic means, I often hear things like, it's about understanding something from someone else's point of view, or it's walking a mile in someone else's shoes. Empathy shouldn't be confused with sympathy. Sympathy is about feeling something for someone else. So, for example, feeling pity or sorrow for someone else's distress or situation. Sympathy does have a role in medicine. Feeling sorry for someone else, or feeling their pain and their suffering, is likely to motivate someone to want to help and to act with compassion. But sympathy can also be unhelpful. For example, sympathy could lead to a doctor to think how they would feel in their patient's situation, rather than how the patient feels in their situation. And this can lead to making assumptions about people and patients that might not be true. But today I want to talk about clinical empathy, which goes beyond the standard definition of empathy. Clinical empathy is understanding empathy within the healthcare setting and the therapeutic role that it plays in medicine. Clinical empathy has three components. Firstly, understanding the patient's situation, perspective and feelings. So, for example, thinking about walking a mile in someone else's shoes. Number two, communicating that understanding and checking it is accurate. So this is about demonstrating to your patient that you have listened. And number three, acting on that understanding with the patient in a helpful or therapeutic way. So, for example, working with a patient to develop a management plan that you both agree on, rather than one that you want the patient to follow. Providing empathic care as a doctor depends on having certain skills. You need to be able to form a connection with a patient. This is so important in medicine. Doctors need to enter into a two-way relationship with their patients, where the patient feels listened to and respected. They need to have clinical curiosity. Without a curious mind, you're not going to make a very good doctor. Doctors need to be mini detectives. They really need to take time to gain an insight into their patients' lives. They need to think about what their patients' concerns and feelings and thoughts are. By learning about patients, not only are you gathering vital information that will help you make a diagnosis, you're also telling your patient that you are interested in them and what matters to them matters to you. Doctors need to be able to take another orientated perspective. So imagining how things are for your patient and really thinking about their situation, what their life is like, what their belief system is, maybe what their religious beliefs are, understanding how their lifestyle is lived, and how all of these things will impact on how they view a situation. Imagining how you would feel, think or behave if you were in their situation is not what's needed. Instead, trying to see the world as they see it and how things are for them and in their situation. And also, people need to be good carers to become good doctors. Acting with compassion and with the right approach, which has been gained through an understanding of how you can best help your patient. But how do these skills really play out in practice? Sometimes it's easiest to think of examples of when they are missing as well as when they are on display. I thought it would be helpful to use a clinical case to give you an example. This is a case from a few years ago. It's about a lady called Jenny, which isn't her real name. who was 33 years old when she had a seizure whilst at home with her 2 young children and husband. It was the first seizure she had ever had, and she went to A&E. The doctors there suspected that she might have epilepsy, so booked her in for some investigations and sent her to an outpatient clinic to see a neurologist. When she saw her consultant in neurology, she asked her some questions about the seizure, about any other medical problems she had had, and she looked at the results of her investigations, including her EEG, or electroencephalogram, which looks at electrical activity within the brain, and she diagnosed her with epilepsy. She told Jenny that she'd likely need to be on lifelong medication and told her to start taking an anti-epileptic medication called valproate. Jenny's consultant told her that she felt this would be the best medication for her. 3 months later, Jenny returned to the clinic. She was still having seizures. Her consultant frowned and said they'd need to increase the dose of the medication, and she would want to see her again in a few months' time. A medical student who was sitting in on the consultation to observe then spent 20 minutes with Jenny to help his own learning and understanding. He took the time to sit and listen and connect with Jenny. He asked her about how she felt about taking the medication and if she had any concerns. She told him that she hadn't actually taken the medicine at all, but did not know how to tell the consultant this. She was worried the consultant would be angry that she hadn't followed her advice. The medical student was curious and wanted to find out why Jenny had not been taking her medication. He felt that Jenny seemed worried about her epilepsy and very worried about the idea of having another seizure, especially when she was with her children alone. So he wanted to understand why she was reluctant to take a medication that was supposed to help her. With careful questioning, he found out that Jenny had read up on the medication when she had collected it from the chemist and learnt that a common side effect was hair loss. This had frightened her. When she was 7, her mother was diagnosed with breast cancer. She had chemotherapy, and Jenny remembers her dying not long after. The whole situation with the medication and potential side effects had brought up some very painful memories, and Jenny was really frightened about the prospect of losing her own hair and her children seeing this. With this information, and being able to understand from Jenny's perspective why she had not taken the medication, the medical student was able to go and talk to the consultant. He could explain what he had found out, and, together with Jenny, a new treatment plan was put into place. Jenny's medication was changed to a different anti-epileptic, one that had no association with hair loss. Of course, Jenny's consultant wasn't cross with her and wasn't angry at all. But as Jenny was leaving, she said cheerfully, "Next time, just tell me if you're not going to take the medication, because it would be much simpler in the long run." So I think this is a great example where a doctor has failed really to provide empathic care. They didn't provide an environment for Jenny to feel comfortable in and to feel open enough to disclose some important pieces of information. In fact, Jenny felt frightened of her consultant. On the other hand, it's a great example of empathic care provided by the medical student. They really took time to connect with Jenny and make her feel comfortable enough to be open. They demonstrated clinical curiosity in finding out why she wasn't taking her medication. They understood the whole situation from Jenny's perspective, and they used all of this to provide her with better care. There are a lot of stories that I could tell you about where I've seen excellent empathic care in practice, and sadly quite a few examples of where empathic opportunities have really been missed. I think traditionally, having empathy for patients has been viewed by some as a bit of a soft skill, something that it would be nice for medical students and doctors to have, but maybe something that isn't essential. And with all the amazing advances that modern medicine has made over the last few decades, the art of being a doctor and the real importance of caring for someone with empathy and compassion might have got a little lost. But that's changing again. There is a huge body of evidence now that proves that educating doctors and medical students, and in fact all healthcare students and professionals, in empathy is not only important, it can be life-saving. There is research that shows that patients who feel that their doctor is empathic and treats them with empathy have better health outcomes than patients who feel they are treated by someone who does not show them empathy. Research has shown empathy and compassion are associated with better patient satisfaction with their care. Patients have better control of chronic conditions like diabetes. They have better mental health with reduced rates of depression and anxiety, and a better quality of life. Studies have even found that patients who rate their doctors as empathic spend less time in hospital recovering from operations than those who don't. One study looking at pain in arthritis found that patients who felt that their doctors were empathic not only rated their pain as lower as a result, but also found that their bloods improved. People who suffer from arthritis often have high levels of inflammatory markers in their blood, a sign that their arthritis and an indication that the level of their disease is quite bad. When treated with empathy, not only did they feel better and in less pain, their body responded in the same way it might if they were given a painkiller like ibuprofen. And if improving patients' quality of life, pain management and mental health just by becoming an empathic doctor wasn't enough, a study from Cambridge University last year found that patients who had been diagnosed with diabetes were 50% less likely to die within a decade if their doctor showed empathy. Their study, along with others, shows that showing care towards patients and putting clinical empathy into practice can be more effective at prolonging life than giving drugs, for example, drugs to lower cholesterol or blood pressure. I'm sure that most people are aware of the difficulties that face the NHS at the moment, and have done for many years, and at the financial restrictions that our doctors and nurses are having to work under whilst trying to provide the best care they can. Providing empathic care is effective at improving quality of life and reducing the risk of death. It costs nothing and has no nasty side effects for patients. But we know that whilst doctors and nurses might want to be empathic practitioners, they don't always deliver the kind of care they want to deliver, or in fact would want to receive themselves. And of course there's many reasons for this, like busy working environments and difficult, stressful conditions. But we know at Leicester that we can train medical students and other healthcare students to understand these barriers and to deliver the best empathic care that they can despite them. And finally, spending time as a medical student developing your empathic skills and becoming an empathic practitioner will not just benefit your patients, it will benefit you too. Medicine is an exciting, inspiring, fascinating and often amazing career, but it is really hard. It's challenging and it can be really, really tough at times. It can be really stressful. Doctors need to be resilient and need to be able to look after their own mental health. Research shows that doctors who practice medicine with empathy have lower rates of emotional exhaustion and burnout and have better job satisfaction. So this is why, at Leicester, we are passionate about educating our students in empathy. I hope that you found this presentation interesting, and I hope that you now have a better understanding of the role of empathy in medicine and why we feel it's so important. Thank you for listening.